name is Beverly Press. I got involved in healthcare in the private sector almost 40 years ago. Stanley C. Myers was the head of a group that started this needs assessment to see if there was indeed a need on Miami Beach. Now, we had a population of people here on South Beach that was what they call medically rich. They had Medicare, but they couldn't even afford to buy one prescription.
People came here to live out the rest of their lives, but in desperation, many have begun taking their own lives. Miami Beach has the nation's highest suicide rate. Fear of crime, loneliness, age, illness, all are causes. But there is something else. A plan to redevelop South Miami Beach by putting up expensive hotels and condominiums and shopping malls calls for the destruction of many places now owned and rented by the old people. Planners promise to give condominiums in the new complex to those whose homes have been destroyed. So far, the planners have not said exactly when the new places will be available, nor have they pinpointed exactly where the people will live. More reasons for the rising suicide rate.
All this time we were searching for a place on Miami Beach. We found old Mendelssohn's Butcher Shop.
And my brother had just finished serving in the state legislature, both as a representative and then a senator. So my dad called on my brother to see what he could do in Tallahassee, and money was appropriated for the health clinic.
And it became Miami Beach Community Health Center. We served only the elderly, and that population disappeared. We saw a change of population in 1980 when 4,000 to 8,000 Cubans came in from Mariel Harbor. And that's when we started seeing the younger ones. And our board was so community-minded and always had people who only thought of it that way.
I became involved because I served as a teacher and principal of the schools of Miami Beach, the junior high school and the senior high school. So children were my primary concern. Miami Beach became a center for the immigrants coming in from Cuba who were poverty-stricken, without any funding, and the children began to fill our schools.
In the county of Dade, state of Florida, last school year, there were 16,660 newly arrived Cuban and Haitian refugee children in publicly supported classrooms. Who picked up the extra tab to pay for the massive job of teaching those kids? The feds came through with only about $5 million, leaving it to the state of Florida to pay $16 million.
The teachers would come to me and say, "You're concerned about these kids. I can't teach them when they're sick. I need help. I need healthy kids to teach." In looking for some group that would help, I found Miami Beach Community Health Center on Washington Avenue, and I came to them and said, "I have children who need help. Will you help them?" "Yes. If you bring them here, we'll provide services." One caveat: if you bring the kid, you also have to bring yourself. Join with us and help us build. South Shore Hospital owned a garage much larger than our space on Washington Avenue. Stanley Myers was our negotiator, so we rented the property for 25 years.
We worked about 60 hours a week, came in on Saturdays, came in on Sundays, worked at nights. We couldn't afford staff if we wanted to provide all the health care we wanted to provide.
I've been here 21 and a half years, and I've had other job offers in the meantime in private practice, but there's 40+ million uninsured people in this country, and that's only growing, unfortunately. One of the major changes I've noticed in this center is the expertise of the doctors coming in. They know our personality, they know our caring ability here, and caring on an emotional level and on a medical level. It's almost like I started with a storefront clinic that has really become quite a well-known entity in this city.
About 15 or 20 years ago, I was at an OBGYN society meeting that we have monthly in the community. We all took a vote and decided that because of our good fortune, we should give something back to the community. So I volunteered as a physician, and then I became a board member, and I got very interested in what was happening here because it was really a wonderful, wonderful place for patients that could not afford medical care to get really excellent medical care. I mean, it was very shocking to me that this place even existed. And I got involved. Catherine Abate, the director, called me and asked me if I would consider coming here as an employed physician with a view towards becoming the medical director. I was in private practice for 25 years. So I said, well, I'll do my private practice 3 days a week and I'll do this twice a week. And what ended up happening is I enjoyed working here so much that I closed my private practice. Some of my private patients followed me here, and I had some pretty well-to-do private patients. And I was surprised that a number of them actually come here to see me. I guess they recognize the care they get here, they can't get anyplace else. We got a report put out by the government that compares all the healthcare facilities that they fund. Our medical services for efficiency were in the 98th percentile in the country, which means that there's only 2% of facilities that are more efficient than we are. In addition to that, our cost to see a patient was in the 10th percentile, which means that 90% of the other facilities in the country, it costs the patient more to be seen. So we are the safety net for the underinsured, uninsured individuals in Dade, Broward, even Palm Beach County, and even the southern counties, because those patients don't have any place to go. They're the people working in the restaurants, they're the people that are taking care of your children, the construction workers. And if we weren't here and we didn't take care of them, they'd be crowding emergency rooms. And we provide a very valuable service to the community. And this is a service that is not available in a private doctor's office. When a patient comes here to see one of us, we do everything. We can do their HIV testing and counseling for free. We can treat them with the medications that they need, often for free, that they could not afford otherwise. And now we are looked at as the focus of a new push to develop models of care for communities, and they're looking at us to be the model of what that care is going to look like so that they can bring it to other communities.